It's an absolutely beautiful building.
In a role reversal, the Prime Minister was taking the pulse of medical staff on Friday as the future of Britain's National Health Service came to the forefront of this general election campaign. President Trump, when he visited the UK in June, had commented that everything was on the table in post-Brexit trade negotiations. He later clarified, saying the NHS was not up for grabs. But the seed of mistrust was sown, and launching their election campaign in Edinburgh on Friday, the Scottish Nationalist Party, or SNP, has promised to slam the door on predatory overseas healthcare companies.
We will fight tooth and nail any attempt to expose the National Health Service to a post-Brexit trade deal with Donald Trump. That is why, after this election, SNP MPs will bring forward a new law, an NHS protection bill.
The SNP says their proposal would prevent Scotland's devolved power over healthcare being overruled by trade deals made by the London government. The SNP wants independence for Scotland and is strongly opposed to Brexit. The NHS is a crucially important issue in the UK, financially and politically. Last year, the equivalent of $200 billion was spent on healthcare in the UK. That's 30% of the entire public services budget. But the maintenance backlog stands at $8 billion. Waiting lists are growing and costs are rising year on year. Patient satisfaction has fallen to 53%, yet politically the NHS still enjoys enormous public affection among voters. Boris Johnson is keen to offer reassurance, and the Conservative election campaign on Friday pledged a new NHS visa to fast-track overseas medical staff into the NHS to tackle the current shortfall of 100,000 staff.
We can do free trade deals with countries around the world, but under us, the NHS is not for sale. It is not for sale. It is not going to be on any kind of international trade negotiation. This is pure Loch Ness Monster, Bermuda Triangle stuff.
The struggle to just keep the NHS going is very real. 67% of acute care NHS hospital trusts are currently running a budget deficit. Collectively, as of March this year, they were $730 million in the red. New cancer units like this one at Guy's Hospital cost millions, and the challenge for the political parties in this election is to work out how to pay for them. Paul Brennan, Al Jazeera, London.